So we're here with Roy today, and Roy's had some implant treatment with us recently. Just tell us a little bit about your story and why you came to see us originally. How were you losing out before you started?
I initially came because I was losing teeth, from gaps in the teeth. My daughter said she was getting married a year later, so I thought
I forgot your daughter was getting married.
Yeah, the biggest thing I wanted to do was turn up to a wedding with no teeth.
Yeah.
And then more teeth breaking off, so that's why I decided to make the journey. I'd done my research, looked around, looked at a lot of reviews, and I picked a dental surgeon, then I met you in the first appointment. We'd done the consultation, then that was it, and the journey began. Yeah.
And how was your daughter's wedding?
How was it?
How was it?
It's fantastic. Yeah. Right, yeah, fantastic.
And did your main motivation was to get your teeth perfect for the wedding?
Yeah, because I'm very conscious about teeth. First thing I look at people is teeth.
Well,
yeah,
it's part of the smart, isn't it?
If
you haven't got nice teeth.
Yeah.
But the wedding day went brilliant. The photos.
Yeah, awesome. Nothing. I wasn't worried about smiling. I used to smile my lips shut. Do you know what I mean? It's like, and you can smile with your teeth out. It was fantastic. And to be fair, I had the temporary dentures in.
Yeah.
At the wedding, and it was still great. And everyone's like, "Oh, how could you have teeth and all this?" And so, and they were only temporary ones, and they were fantastic. So it was, if we didn't have them, I'd have been,
Because we hear this time and time again. We've heard it a couple of times when we've been with patients this morning, and about hiding your smile.
Yeah.
And smiling with your lips.
Yeah, or you put your head down and
or you put your head down.
Yeah. Do you know what I mean? It's just like, I used to hate having my picture taken, and now I put everyone now. And I'm jumping in everyone's photos now. Do you know what I mean? Because I used to just hate it, because every time I've seen my teeth, it was like, no, look at them teeth. So I zoom in and be like, oh. And now it's like, I've got no worries at all now.
So, because I've noticed it's changed your confidence quite a lot.
Yeah.
And how you feel about yourself.
Yeah, definitely. I think it does, definitely. Because you're not afraid of approaching people now, because you can talk with your mouth open rather than if they say something you want to smile, you can't smile. So, it's so much more awkward. So you can't interact with people when you can't smile.
No.
Do you know what I mean? Unless you tell them off. It's like, but that's the main thing really. That's been fantastic, and it was, it wasn't a short thing, which I didn't expect. But it was an interesting journey. It was like I was very informed on the way, and we'd done things right, and I wasn't left with no teeth, and that was the main thing.
Yeah.
I experienced no pain at all. Do you know what I mean? I was saying to your colleague,
even after the implant.
Even after the implants, even I had 6 implants put in that day. I imagine going to bed being like it. I didn't know I had it done.
No.
You wouldn't even. You could feel like a little bit, but you wouldn't. I wasn't in pain.
No.
I didn't
Certainly
take
didn't
painkillers.
realise you had.
No, I didn't take painkillers or nothing. There was no pain at all.
No.
And it was fantastic. And when you think about drilling into your gums, you think, oh, it's going to be. But no, it's absolutely pain-free.
And actually, a lot of people say that their biggest concern is about the drilling into the gum.
Yeah.
And I always say to them that it's very different to what you're anticipating from drilling normally.
That's right, yeah. When you're drilling into a tooth.
Filling or doing things like that. It's very short, isn't it?
Yeah,
a few seconds.
Yeah, a few seconds. That's me. It probably took a couple of minutes to do the whole 6.
Yeah.
So I mean, it doesn't take long once you get there.
And how does it feel to have it drilled?
No, I wouldn't. Nothing really. It felt a little bit awkward. The pins were in, but it's not really awkward. Just I wouldn't say really nervous, to be honest.
And how would you say you were before treatment? Are you a nervous patient, or?
Yeah, I used to. I've been to a few dentists in the past where they've took over and jumped needling. Yeah. I mean, it's like a javelin, and it's like,
And how was my LA technique?
Doing injections I did like as a pallet and that.
Oh yeah,
on the roof, on the
roof.
But the rest have been fine.
Yeah.
Yeah, I've never ripped your arm off your seat, have I? So
I've still got both arms.
And I've been pretty pain-free really. I've got to say, it's nowhere near as much pain as I thought it was going to be. When you think a whole new lot of teeth,
exactly.
You think, and it's like when I had the extractions, like no problems. I didn't get any dry sockets or nothing like that. No. I think it was fine. So.
And how are you finding? Because mini implants are a solution for people if you're missing sort of multiple teeth. They're this one-piece implant system with a little stud on there. They go straight in, a little bit like a self-tapping screw, although I don't like that analogy entirely.
Yeah.
And it's got this little black ball on the top, which then clips into the denture, so that the denture is actually held by these little pop studs.
Right.
But how do you find being with them? Because wearing a denture without these, they move around.
Yeah, I couldn't eat a lot of food. A lot of food I couldn't eat because it just pop out. Do you know what I mean? Slide and stuff like this. And these now, 6 pins, and they don't move at all. And you laugh or do anything more or less. They don't move.
Yeah.
They don't move.
So you can pretty much eat anything you want.
Yeah.
You can. It doesn't come down when you're talking or
No,
when you're eating.
never.
You don't get a massive amount of food caught around now.
No. Before it used to be like, it's horrific before because the gaps are massive, right? Because obviously your gums shrink back. And,
Yeah.
Do you know what I mean? None of that. And it's like there's absolutely none of that. And I was saying to your colleague earlier that when you say to people about implants, they think they never come out. So I started thinking about it every night and they go, how? So they just pop out and go, I thought it was screwed in forever. I said, no, not these. It's just like the 6 pins you pop in and out.
This is a removal option.
And everyone's still amazed about it, really, because I think as soon as you mention implant, you think the tooth's in there for life.
Yeah.
You think it goes in, that's it, and stays in. But no, it's remarkable, really. And so much easier to clean. Do you know what I mean? The crevices and stuff like this. So
Yeah, easy.
it is really, it's very easy.
One thing I remember after we did the implant placement, and I remember beforehand you were saying, I'm worried actually the temporary ones are a little loose at this stage, and will it follow on to the final ones?
Yeah.
So we saw you infit the final ones, and you were over the moon with
Oh mate, I'll tell you, the roof of my mouth, where the guard goes on, the metal guard, there used to be like a gap, like probably about 3 mil. So it's like you could run your fingers on the roof of your mouth, and you'd stop on that gap, and because obviously it was, I don't know if it was acrylic or whatever it is, but this metal one just snug. I can rub my finger across the roof of my mouth, you wouldn't even know it was there.
Lovely.
It fits like a glove. Really
But
does.
remind me when you came in the next day, because you were saying beforehand, I'm struggling to get them in and out, and get them in and out too easy, and they're dropping. The next day you came in.
I couldn't get them out.
Couldn't get them out.
No, it
So-
was fine. I tried everything. I tried literally, and near point, I almost passed out at one stage. I pulled it so hard, and I thought I'm going to knock myself out of me on the table or something. It's like, I just couldn't get them out. It must have been like a vacuum or something, wasn't it? It must have been like a vacuum.
But actually the hold is so good now with that denture, it doesn't move around at all.
No,
but actually, rather than just being able to it dropping or falling out, you actually have to physically
you
give it a pull to get out.
And I've got the smallest fingers, so I can't get it right around the back. So I'm like, it's like, but it comes out quite easily. No, not as easy.
Oh, we can make adjustments. Like
no,
you said,
it's fine the way it is. I'm happy the way it is. So it comes out, I give it a little bit of a.
No, but I mean, we did do some little adjustments to get it just right. So get that, that perfect spot between getting it in and out easily, but getting it to hold in.
And also, if we do get any problems, I use that little tool you give me.
I forgot to give you that little tool.
Yeah, a little tool, just put it down one side and comes right out then. Yeah, that's fantastic, it's great.
And how's it affected your life since, in terms of?
Well, I guess I've got more now. Do you know what I mean? Before I wouldn't like go out social events and stuff, and weddings and parties, and I used to try and avoid them if I could.
Yeah.
But now I don't mind that. Now I'm quite happily, I've got a wedding next month, which I normally dread weddings because it's 11 hours standing around, isn't it? Do you know what I mean? It's like, pretend you like people, do you know what I mean? But now I don't mind so much because obviously now I can smile and laugh and not have to laugh and look at the floor. Do you know what I mean? And it's also, I feel, it's like for your kids as well, you're saying to your kids, brush your teeth, brush your teeth, brush your teeth. Yeah. And you've got rotten teeth yourself. Do you know what I mean? If I hit a bit.
As a role model.
I've shown them some of the things, some of the pictures, just to say, look, this is what happens if you don't brush your teeth. Do you know what I mean? Just try and, it's not a scare tactic maybe, but just try and keep them keep on top. And my kids' teeth are fantastic.
Good.
Do you know what I mean? They really are good. And my wife's teeth's fantastic. She's had a brace and she's 45, so she's got really good teeth as well. And it's just me. Do you know what I mean?
And what would you say to other people thinking about having an implant option or an implant solution?
Just do it. Just come in and do it. Just have the consultation, and there's no fear. Honestly, there's nothing to fear. Absolutely nothing. Do you know what I mean? It's not. And I'm the worst person in dental chair. Believe me, I've walked out with some dentists before. Just on seeing the needle, I walked out. I'm probably the worst person, but it was so easy, and everyone's so nice, and
Great.
it was absolutely
Thanks,
really.
really.
No problem.
You've been amazing.
That's been a good journey. Yeah, it was.